Hello and welcome to Where Women Talk. I'm Nadia Jordana. My guest today is Jean McKoy. She is a skilled skincare professional in Sacramento, California, and she has some valuable advice and information for us today. So let's not hang around here. Let's go talk to Jean. Hello, Jean. Welcome to the show.
Well, hello, Nadia. Thanks for having me.
Jean, tell me where you are. You're out there in California. What city?
Yes. I am in Sacramento, California. Right in the heart of the city.
Tell us about what you do and what your business is.
Sure. Well, I am a clinical esthetician, which basically means I practice medical grade treatments such as chemical pills, for example. That's what I specialize in. And chemical pills are pretty much a resurfacing of the outermost part of your skin, which is called your epidermis. So it's focusing on this outer part of the skin, but it actually deepens into the dermal area to create what's called cell turnover. So people who suffer from sun damage, pigmentation issues, melasma, old acne, scarrings, they're good candidates for chemical pills. So that's what I specialize in.
Now, does it take a long time to do a chemical peel?
It doesn't take a long time. There is a process. So for example, there are varying levels of chemical peels. You have what's called your non-aggressive chemical pills, and then you have your aggressive chemical pills. And that's where the aggressive side is where you peel like a reptile, where I'm really creating first through fourth degree burns on the skin to remove old skin and allow new skin to return. But before you get to that level, you start off at the basic level, introducing the acids into the skin slowly, and then you ramp up. So I'm doing treatments every 4 to 6 weeks, and each one is more aggressive than the next. And I do that as a precaution to make sure that the skin doesn't have a reaction to the acids. So you can't really go 0 to 60 on virgin skin. There is a prep process and then a progression process for chemical pills. So never let anyone outside of a doctor do an aggressive chemical peel on virgin skin. You can cause some serious damage to the skin.
Yeah, it sounds, when you talk about it, just hearing the acids and words like that, it sounds scary. So I doubt that if I ever had to have that done, I would want to start off slow and
Absolutely
what you need. Does it hurt very much, or does it hurt at all?
The non-aggressive peels are pretty mild, and so I liken it unto, let's say, if you scraped your arm and you applied some peroxide or alcohol to that area, that little stinging sensation that you would get for a few seconds, that's what it's like for the milder peels. And the milder peels, you will not see the amount of sloughing that you would with an aggressive peel. Your aggressive peel, they are layered and timed, and so they expire within a 5-minute interval. So the more layers I apply, yes, you will burn. You will feel like it's a bad sunburn at the end. So it's that feeling, but it's over time with the layering, and that's where the sloughing begins.
I think if you're mentally and emotionally prepared, then a little bit of pain for a lot of beauty doesn't matter.
Right, as my clients would say, no pain, no gain, right? So, but like I said, chemical peels are something that is achievable. It does take care of sun damaged skin. and melasma. I see a lot of melasma clients and melasma is just an overproduction of color in the skin,
Is
and
that the
people of color.
spots?
It's a pattern, so it's a spot with a pattern typically, and it's only prevalent in skin of color.
Oh,
So your skin type would never incur melasma unless it's driven by a medication, but for your skin type, you would never have to worry about that.
okay. Now, do you work with both skin of color and white skin? Do you have,
Absolutely.
okay.
All skin types, all ethnic backgrounds, male and female, and teenagers. So within my practice, I deal a lot with teenagers going into adolescent,
Sure.
and parents are bringing them in because they're not listening to them for their hygiene care. So they come in and I treat them. We talk about diet because what we see on the outside is coming from what was inside. So diet has a lot to do with how we look and feel externally.
So diet really does make a difference with acne and the skin.
Absolutely, absolutely. I use a technique in my practice. It's called Eat Right for Your Blood Type. And Dr. Peter J. Diamo was a naturopathic who discovered how food has a direct correlation to our weight gain or lack thereof, and then of course the overall skin's condition since it's the largest organ of our body. And my acneic clients, a lot of their problems are due from inflammation, and inflammation of the gut is what's causing the external breakouts because it has to escape. The pores in our face are the largest on our body, so toxins are coming through those pores.
Okay, that's very interesting. Well, what other kinds of things do you do in your practice?
Well, one of the most recent things over the last 3 years I've started doing, I became a certified paramedical artist. And what that basically means is I tattoo on brows. So I'm sure you've seen the trend of people doing the brow micropigmentation in the brows or microblading in the brows. So I do brows.
You do eyeliner?
Yes, I do eyeliner, I do lip liner, lip color, areola
We live
pigmentation.
closer together.
Yeah, so I see cancer patients who have gone through reconstruction of the breast and they are missing their nipples and the pigment around the areola. So I'm able to tattoo on pigment around the areola after the doctor gives them a nipple or not. Some clients don't want the nipple, they just want the pigmentation back in their breast. And so I'm able to do that. And also for acne scars. So after someone has gone through a chemical peel series, and we remove most of the scarring, but there's still some dimples or a little bit of darkness left in the skin, then I'm able to actually tattoo and pigment to give them more of an even complexion and to erase those scars.
What kind of things now? Right now with COVID-19 and in the state of California, you aren't seeing clients right now. Is that true?
No, I'm closed currently.
Yeah, but you'll be available as soon as things
As soon
open
as we
up.
reopen, yes,
Why don't
yes.
you give us a few tips that ladies can do at home right now until they get a chance to come in and see you?
Absolutely. Well, depending on the climate that you're in currently, the most thing I can give the most advice on is actually sunscreen is definitely very important. For women 40 and above going through menopause, peripause, the change in general, we lose collagen and elasticity in the skin. And so what actually restores the collagen or stimulates more collagen are acid-based cleansers that you cannot buy the percentage that I'm going to share with you over the internet. I carry the acids that you can purchase. However, glycolic acid is one of the top main ingredients that actually stimulates collagen in the skin. So a 10% glycolic acid cleanser is really good to stimulate the collagen and to remove dead skin cells. Some other things you could do at home, for example, if you're having what's called milia, and during the summertime, a lot of us are plagued with milia, and they're little tiny bumps all over your face or parts of your
I've
face.
seen that.
Mm-hmm. And that comes from perspiration. It's a form of dermatitis, which is dirt. So when we sweat and we're not removing it right away, it causes bacteria to the skin, and those little bumps come up. So a good home care solution to get rid of those bumps is mixing some baking soda and water. Create a paste, apply to the area, let it set, rinse. It kills it. It creates a what's called a benzoyl peroxide exfoliation.
Oh, that's fantastic to know.
Yeah.
Yeah. And when you get your doors open again for clients coming in and out, you are again in Sacramento, California.
Sacramento, California. Mm-hmm.
In the meantime, they can go to your website and say that website name. I'll put it up also.
Absolutely. To visit my site, please go to Faces, that's plural, skincare, one word, centers, plural.com. And there I have a whole host of information and product recommendation that you can read about and shop online there. Also, I do online consultations. Since we're under COVID, I've been doing a lot of online consultations through Zoom with clients who are interested in some type of home care regimen. So I'm more than happy to see anyone who books with me.
Well, that's important for people to know, is that they can have an online consultation. They're doing that now with the doctor's offices,
right,
and everywhere else. So it's just kind of the normal way of things for us.
Right. Actually, we're getting ready to go into chemical peel season, the aggressive peel season, because I don't do aggressive peels during the summer. It's too hot and it'll damage the skin even more. So at the end of October, chemical peel season begins. So now's the time to start prepping, because there is a home care prep regimen that needs to happen to get ready for the peel season. So a lot of my clients will start to prep their skin now.
Okay. Do you have any last words of advice?
Yeah, drink lots of water. Hydration is critical to a living organism, which is the skin and all of the things internally. But people mistake proper hydration for guzzling water. That's not proper hydration. Proper hydration is small sips of water over a long period of time. So it should take you at least 45 minutes to sip 12 ounces of water. And we need to have 64 ounces of water as a daily allowance. That does not take into consideration caffeinated beverages or carbonated beverages. Those are diuretics. So proper hydration, and for every ounce of caffeine you consume, you need 2 ounces of water. And that's the only time you should guzzle water, is when you're having alcoholic beverages or caffeinated beverages, because you want to flush the system so that that acid doesn't remain in the system and dehydrate you.
Good advice. Thank you, Jean, for being on the show today.
Well, thanks for having me. It's a pleasure.
We'll talk to you again.
All right. Thank you.
Bye.
Bye.
Thank you for watching. I hope you liked the show. We'll see you next time on Where Women Talk.